Why is tubal factor infertility hard to diagnose? Imagine trying to solve a mystery where the clues are hidden in plain sight. That's often what diagnosing tubal factor infertility feels like. The reason it's so tricky is because the fallopian tubes do more than just connect the ovaries to the uterus. They perform several complex roles like picking up the egg, allowing fertilization to happen, and transporting the embryo to the uterus for implantation. Even if tests show the tubes are open, it doesn't mean they're working properly. The internal lining of the tubes, called the mucosa, can be damaged or scarred, which can interfere with these functions without causing a complete blockage. This kind of damage isn't easy to see with standard tests. The most common initial test is called hysterosalpingography, or HSG. It involves injecting a special dye into the uterus and taking X-ray images to see if the dye flows through the tubes. If the dye passes freely, the tubes are considered open. But this test mainly checks if the tubes are physically open, not whether they're functioning well. It can miss subtle issues like scarring or damage inside the tubes that prevent eggs or embryos from moving smoothly. So, even with a normal HSG, a woman could still have fertility problems or face an increased risk of ectopic pregnancy, where the embryo implants outside the uterus, often in the tube itself. To get a clearer picture, doctors might recommend laparoscopy. This is a minimally invasive surgery where a small camera is inserted into the abdomen to directly look at the tubes and surrounding tissues. Laparoscopy can reveal adhesions, endometriosis, or other abnormalities that might not show up on imaging tests. It also allows the doctor to see if there are inflammation or scar tissue around the tubes that could be impairing their function. Sometimes, specialized procedures like tubal catheterization are used to evaluate the mucosal lining, but these are less common because they are more invasive and complex. Diagnosing tubal factor infertility becomes even more complicated because it can be caused by many different issues. Pelvic inflammatory disease, endometriosis, previous surgeries, infections, or congenital abnormalities can all damage the tubes in different ways. Some damage is microscopic or related to the health of the tubal lining, which makes it hard to detect with routine imaging. Recent research suggests that the microbiota, or the bacteria living inside the tubes, might also play a role, adding another layer of complexity. In cases where endometriosis is involved, it can cause inflammation, adhesions, and distortion of pelvic anatomy, making diagnosis even more difficult. Endometriosis-related damage to the tubes might not block them completely, but can still interfere with their ability to transport eggs and embryos. This means that even if tests show the tubes are open, they might still be dysfunctional. All of these factors contribute to why diagnosing tubal factor infertility isn't straightforward. Standard tests like HSG are helpful but limited. They don't assess how well the tubes are functioning internally. More detailed procedures like laparoscopy are often needed to get a full picture, but they are invasive and not always the first step. Sometimes, damage is microscopic or related to the health of the tubal lining, which makes detection even harder. Because of this, doctors relying on a combination of tests, patient history, and clinical judgment to make an accurate diagnosis. In the end, understanding that tubal damage can be hidden or subtle is key. Each woman's situation is unique, and a personalized approach by fertility specialists is essential. If you're experiencing fertility issues, it's important to discuss all these options with your healthcare provider, who can guide you through the most appropriate testing and treatment plan based on your individual circumstances.